Today we'll be talking on topic of management of unstable angina and non-ST elevation myocardial infarction. Regarding the management of this condition, we do risk stratification with either TIMI risk score or GRACE risk score, and we look for if there are high risk features like type 2 diabetes mellitus, ejection fraction less than 40%, GFR less than 60, or prior history of CABG, prior PCI within 6 months, or if patient have early postinfarction angina. These indicates high risk features, and in these high risk conditions we need to consider think that he might require invasive strategies. Okay, also there can be one conditions in patient have hemodynamic instability. There is refractory angina, no, and heart failure. In those conditions, you may need to go for immediate invasive strategies. Immediate invasive means within 2 hours. You have to need to proceed towards invasive, catheterization. So let me write it here. So I told you that we do risk stratification. So risk stratification is done with TIMI risk score and GRACE risk score. If TIMI risk score is 0 to 1, and if you see GRACE risk score is less than 109, and if there are no high risk features, in those conditions you can choose for medical management. Medical management means you can start dual antiplatelet therapy. But let's suppose TIMI risk score is 2 or greater, GRACE risk score is 109 to 140. In this condition, it won't be appropriate to do only medical management. You may need to proceed towards delayed invasive strategy. Delayed invasive strategy. It means catheterization within 72 hours. Okay. And I already told you that if patient has a high risk features like type 2 diabetes mellitus, ejection fraction less than 40%, GFR less than 60, early post-infarction angina, prior PCI within 6 months, or prior history of CABG. Okay, if you see these conditions, you also need to think towards the patient needs invasive strategies. Okay, and you should prepare for that. And let's suppose if GRACE score is greater than 140, or if you see new ST depression or temporal change in troponin, temporal change in serum level of troponin. In these conditions, you need to go for early invasive strategies, means invasion within 24 hours. Okay. So we talked about delayed invasive strategies, early invasive strategies. Now remaining is immediate invasive strategy. Which means invasion within 2 hours. So what are some of the conditions where you need to think that patient needs cardiac catheterization immediately? So one is obviously hemodynamic instability, heart failure, EMR that is new or worsening, refractory angina despite nitroglycerine treatment, and sustained VT or VF. Okay. So in a nutshell, what we learned about management of unstable angina or NSTEMI is that we do TIMI risk scoring, we do GRACE risk scoring, we look for if there are high risk features in patients or not, or if patients is hemodynamically unstable, has refractory angina, heart failure. So we look for these things, and based on this we decide whether we need to go for just only medical management, or we can think of doing cardiac catheterization, invasive approach. So in invasive approach we also saw that there are 3 modalities. So within 72 hours, within 24 hours, and within 2 hours. This is called delayed invasive strategy, this is called early invasive strategy, and this is called immediate invasive strategy. So immediately catheterization is required when patient is hemodynamically unstable, has heart failure, if there is new or worsening mitral regurgitation, refractory angina despite medical therapy, or if you see VT or VF that is sustained. In those conditions, activate cardiac cath lab. So patient might need immediate catheterization. And for deciding about delayed invasive strategies or early invasive strategy, I told you that you look for TIMI risk score, Grace risk score. If TIMI risk score is 2 or greater, we go for delayed invasive strategy. If Grace risk score is 104 to 190, we go for delayed invasive strategy. But if it is greater than 190, then we go for immediate invasive strategy. Okay, within 24 hours. Or if patient has high risk conditions like type 2 diabetes mellitus, prior PCI within 6 months, or prior history of CABG, early postinfarction angina, has ejection fraction less than 40%, or GFR less than 60. In those conditions, you should think that patient might need early invasive approach. Okay, so this is in a nutshell about management of unstable angina and NSTEMI. Thank you.